Hello, hello, and welcome. I know it says DeShawn Taylor, but I am going to rename myself because I am Michelle Yvette Ponce, and I welcome you all. And in the meantime, I want to go ahead and welcome everyone to Desert Star Institute for Family Planning and our commemoration, our event to commemorate the anniversary of Roe versus Wade, the 50th anniversary. My name is Michelle Ibe Ponce, and I am the Deputy Director of Desert Star Institute for Family Planning. It is my absolute honor and pleasure to invite you here today to this space as we talk about what is life after Roe. And so tonight's webinar and fireside chat is called Undue Burden, Life After Roe. And we're going to be having a few folks that are leading this work of increasing quality care for reproductive services and rights to all here in Arizona and also nationally. And I would love to welcome them to this space. And I would love to introduce our guests today, our co-hosts and co-panelists, you could say. My name again is Michelle Yvette Ponce, and I'm here very honored to present Dr. DeShawn Taylor, MD, who is a Phoenix, Arizona based award-winning gynecologist and family planning specialist, gender affirming care provider, and reproductive justice activist, and now author, whose work advances reproductive health care access through direct services, education and training, advocacy, and leadership. Dr. Taylor sees patients at her Desert Star Family Planning Independent Abortion Clinic, facilitates coalition work and community programs with the nonprofit Desert Star Institute for Family Planning, and guides organizations through transformational social change with a focus on bodily autonomy, abortion, and gender with her consulting company, Health Justice MD. Dr. DeShawn Taylor was born and raised and trained in Los Angeles, California, and Dr. Taylor has called Arizona her home for 14 years. Her Doctor of Medicine degree was conferred by the David Geffen School of Medicine at UCLA. She completed her OBGYN training at King Drew Medical Center and complex family planning training at the University of Southern California, where she also conferred a Master of Science degree in clinical and biomedical investigations. So we want to welcome our beloved leader, advocate, Dr. DeShawn Taylor, to tonight's conversation. And then last but definitely not least, I would love to welcome Arpita Appannagari. And I don't know if I said that correctly, but okay. Her MPH. She's a policy and partnerships manager at the National Institute for Reproductive Health. At NIRH, Arpita supports partners in their progressive and proactive work, from policy advocacy to coalition building and beyond. Arpita also supports partners in capacity building and skills development across areas of expertise within NIRH and within the movement at large. Arpita currently serves as on the board of former NIRH partner the Beauty Well Project and continues to support local New York City-based South Asian-led organizing efforts. Prior to NIRH, Arpita worked in harm reduction, person-centered advocacy, and policy change for people living with HIV, as well as international gender-based violence and reproductive health and rights work with refugees. Arpita is from Indiana, currently based in Brooklyn. I always want to say it like that. And is a Hoosier through and through. I'm assuming Hoosier has to do with Indiana, right? And in her free time, she likes to foster dogs or otherwise work with animals and crochet for all her baby and animal friends. Oh, thank you so much for being here, Arpita. And so now I'll introduce them both. They're going to take over the conversation, and we welcome you to stay engaged in the chat as we have a conversation about life after Roe. Welcome. Thank you.
Thank you so much for such fabulous introductions, Michelle. Thank you for getting us moving along with this event tonight. Your energy is always infectious. So thank you so much. And we are going to go ahead and get into this. So, Arpita, gosh, it's so great to be on this call with you tonight. We just had the 50th anniversary of the Supreme Court decision Roe v. Wade that happened January 22nd, 1973, which legalized abortion across the entire United States. And so, although it really is still the anniversary, we are not celebrating the protections of 50 years of Roe v. Wade. We are definitely in, a very different place than we expected, right? Where there are 14 states without an abortion provider, and still more states with restrictions with how far along someone can be in pregnancy to have an abortion. And other bans that are in litigation right now, they're going through the courts. And so, working with a national organization like the National Institute for Reproductive Health, you have a lens that's broader nationally about, what's going on, what's the landscape. So the first question I have for you is, what have you seen partners with your organization be able to accomplish to protect access to abortion across the country?
Thank you. Hi, DeShawn. Hi, everybody. Thank you, Michelle, for that introduction. I'm really glad to be here with you all. And I think you ask a great question, right? I think the news captures a lot of the bad. The news captures the bans, the news captures the really sensationalist headlines around prosecution and investigation of pregnant people, all of which is true and happening and important. NIRH works on the proactive side of things. So we work on the offensive. We work to enhance and expand access to abortion care and other reproductive rights. So June 24th, when the Dobbs decision came down, it would have been very easy for our partners, especially doing proactive work, to take a step back and say, excuse me, and say, you know what? We have to go on the defensive. We have to start pushing the bad back. We have to completely change our strategies and kind of panic. What I love is that just in the 3 months between the Dobbs decision and October 1st of last year, we saw a number of state and local policies that were passed that were very proactive and very bold and very exciting. We saw partners in places like Texas and Kansas City, Missouri, and Tennessee pass ordinances that were addressing the access to abortion through funding. So addressing insurance coverage and addressing, how exactly are people going to pay for abortion care, even if their state is not able to provide abortion care. And we saw, what most people would call the unusual suspects. We saw places like Georgia, places like Idaho, places like Ohio, really step up to the plate and say, you know what, we're directing municipal funding straight to abortion access. And if our state stops us from directly funding abortion services, then we're going to fund practical support. We're going to fund people to travel out of state. We're going to fund people to stay in a hotel, to be able to afford to travel at all, to take care of, their CVS order for a Gatorade after their abortion, which is maybe a personal story. That's exactly what I needed after my abortion. I went straight to CVS and got a blue Gatorade. We have seen states like California and Massachusetts step up and pass protections for providers. So protecting providers from out-of-state policies that would seek to criminalize and penalize them. We have seen localities step up and say, you know what, we're protecting providers and we're protecting the helpers. So Pittsburgh, Pennsylvania and Seattle, Washington have, directed their city to not cooperate with police investigations of providers and abortion helpers. And I think, the last trend that I want to mention is expanding models of care. So we're not only, addressing access to abortion through funding and access to abortion by being anti-criminalization and being abolitionists. We're also saying the ways that abortion can be done need to change and need to expand. We need to allow advanced nurse practitioners to perform abortions. We need to be able to expand access by expanding who can perform an abortion. And so we saw that in California, Washington, Massachusetts, New York. Our partners really stepped up in huge ways after Roe. And the last thing I'll say is we are lucky enough to partner in Arizona with Desert Star Institute for Family Planning. And it would have been really easy for DeShawn to walk away from advocacy and say, you know what, I have to save my job. I have to save my job as a provider. But she didn't. And we are here in 2023 with a 15-week ban on the books in Arizona and a proactive plan for Arizona, a campaign plan to hit at every level, the executive, the legislative, state, and the local level, to really hit hard on what reproductive freedom can look like in Arizona.
Yes, and thank you for shouting out Desert Star Institute for Family Planning. And it is, as you mentioned, it's so easy to fall back and get into a defensive posture, especially in these difficult times. I mean, in Arizona, we've been in a defensive posture for a very long time. And so for me personally, when I was looking at the very high likelihood that Roe v. Wade was going to be overturned, my philosophy was I want to go out swinging. Like, I'm not going to just lay down and just let these things happen without at least fighting and being able to feel like we put it all out there for the people who are counting on us to do that. And so, we have a very interesting situation here in Arizona, but at the end of the day, people have access to abortions at least up to 15 weeks, which is better than no access at all, but people are still being harmed. And so my next question for you, Arpita, is what have you seen to be some of the challenges?
I think, honestly, Arizona is a great example of some of the challenges that we're seeing, because there is immense power in the advocates in Arizona, and there is immense blockades put up by the legislative body. So Arizona presents kind of a particularly challenging environment, or a unique environment, that I think speaks to the larger challenges in the movement right now, which is that there is a split in party between the governor and the legislative body. So, Governor Hobbs has been very out loud and proud about her support for abortion access. And the legislative body has been very out loud and proud of their anti-abortion status. And so trying to find opportunities for advocacy when there is a split between the branches of government is incredibly taxing work, and takes a lot of not only, willpower and strength, it takes a lot of knowledge building. And so advocates in Arizona and advocates across the country are really hungry to learn. And that's what we need, because the challenges ahead are really trying to be creative and be nimble and be quick on our feet about the kinds of policies that we can pass at the local and at the state level that will not face immediate preemption or immediate denial by the state legislative body, and that will actually create a better environment for access, or will actually have a huge impact. And I think another one of the challenges that I know we'll talk about soon is the power of disinformation and the power of stigma. The anti-abortion, right to life folks have been very, very on message for 50 years. And their message has been abortion is bad, and here are the medically unsound, scientifically, unscientific reasons why. And their message has gotten across. Disinformation plagues our movement. It is everywhere. It is around every corner, and it is spread by anti-abortion pregnancy centers or crisis pregnancy centers. It is spread by state legislators. It is spread by federal legislators who have the gall to talk about a quote unquote born alive bill on the floor of the United States Congress. So I know we'll get into a lot of these issues later, but I would say that, the biggest challenges facing us right now are that we don't have a floor to stand on. We really have to be creative, and we really have to kind of think on our feet, and that is hard to do.
And so, yeah, the floor to stand on was Roe v. Wade. And it appeared that once Roe v. Wade, when we got that decision, it's like people are like, oh, we got what we fought for, we can stop fighting. Not understanding that it was the floor, not the ceiling, right? And that there was still an ongoing need to shore up protections for people to really have meaningful access to abortion care. But the opponents, they got to work right away, and they just continued to build this momentum that reached a fever pitch more recently, due to some of the other kind of disenfranchisement and just cynicism, right, that has crept into our society over the last few years due to administrations and policies, right? So the one thing that we can point to find a silver lining, so to speak, is that we do have the opportunity to dream bigger and dream for something better and create something better. And so, once we kind of allow ourselves to stop free falling and think about that, then that is something to be excited about, actually.
I absolutely agree. And I think your book does a really excellent job of taking us on the journey with you, of really understanding what it means to dream of a bigger and more beautiful future. So I would love to start talking about Undue Burden, Life After Roe. I had the incredible opportunity to read DeShawn's work in this book, and it is deeply personal and deeply impactful. I have myself been lucky enough to work with DeShawn since 2020 and see firsthand the immense pressure that comes with putting hands on bodies as your job, as DeShawn does, and dreaming and visioning for what the future can look like for your patients, for your family, for your communities. And what DeShawn has done is distill all of that experience into this wonderfully hopeful book. And I think it's kind of audacious to be hopeful. And so I'd love for you to tell us a little bit about Undue Burden, Life After Roe.
Thank you for such kind words about the book. I'm so glad that you had the opportunity to read it, as someone that I admire greatly in our collaborations that we've had over the last 3 years here. So the title of the book is Undue Burden, a Black woman physician on being Christian and pro-abortion in the Reproductive Justice Movement. And when the Supreme Court took up the Dobbs versus Jackson Women's Health Organization case, which was the 15-week ban that has been copycatted across the country and is currently a law that's being enforced here in Arizona, I thought to myself, oh, the Supreme Court is going to seriously consider overturning Roe v. Wade with this case. And the reason that I thought this was because there were varying compositions of the court that declined to take up cases that would directly interrogate Roe and put them in a position to change precedent, right? And then after listening to the oral arguments for the case in January of 2022, I told several people at the publisher that Roe v. Wade would be overturned. And every single person thought that the idea was far-fetched. But it happened June 24th, 2022. I began forming this book in February of 2022 and wrote it through the leaked draft of the Supreme Court opinion for Dobbs, the overturn of Roe, and the enforcement of a total ban in Arizona. And so this book invites you into my innermost thoughts, shares my hopes and dreams, hopefully teaches you something you didn't know, and or affirms and inspires you. And so I'm going to drop a link into the chat to a blog that I am writing up until the book is published, with inspired by the book. And then you can also sign up on that homepage of the blog to learn more about when the book is actually going to be released, pre-order, and events around that. And so I thank you all for the opportunity to really give to you the gift that honestly was very therapeutic for me going through everything that was going on. It took a lot of time and effort, but also too, it put me in a position to really think through and process what I was going through and what I felt to be the path forward.
As I said, was able to read the book ahead of time. I've never felt so cool in my life. And I put together some questions, the burden questions that I had while reading the book. And I think the first one is related to the really, loving discussion that you have about reproductive justice and how we need to shift from a rights framework to a justice framework. And I love that you said the definition of insanity is doing things the same way and expecting different results, and that reinstating Roe would be a symptom of that insanity. So I'd love to hear, from your perspective as a physician and as an advocate, how do you see the practice of abortion care and access to abortion changing as we shift from reproductive choice as our lens to reproductive justice? And how do we translate reproductive justice to, the masses?
So I personally have gone through an evolution from a reproductive health-based framework to a reproductive rights framework to the reproductive justice framework. And so in my own evolution, I've really been able to think through what things that I go through, what things that I think about, what were the things that really had me leaning into reproductive justice and how I incorporate that in how I take care of patients, how I train the next generation of abortion providers. And the first thing that I want to say is that there are different frameworks to address what is reproductive oppression. And it is forces that interfere with people's ability to control their own reproductive destinies. And it looks very different ways. And the reproductive health framework is a way to address it. The reproductive rights framework, in terms of policies and advocacy and those type of things. But then what's the good of a right if someone cannot access it? And when people are oppressed, they don't have the conditions necessary to be able to demand that their rights be exercised, that they actually exercise their rights. And people cannot exercise their rights when they're oppressed. And there are various reasons that people are oppressed. Systemic racism and bias in the healthcare industry is a really big one. Social determinants of health, how people are interacting with their environments impacts their health behavior. And so when we're looking at things from just a health framework, that is a very individualistic framework that doesn't account for the interaction between people and their environments and their communities that are impacting the choices that people make. And then again, the rights framework, again, ignores the fact that a right doesn't matter if a person doesn't have what they need to actually exercise the right and actually get what they need. So when we move into a justice lens, then what we're looking at is, and actually let me go back, the rights framework also is anti-government, keep the government out of my womb, my body, my choice. We don't want government interference. However, the justice framework holds the government accountable for their role in creating the conditions for people's choices to be affordable and accessible. And so justice then gives us the pulpit, so to speak, to go to the people who are supposed to be representing us and say, hey, you need to be doing this differently, and this is why. And it's an intersectional framework in which you start to then look at all of the different ways that people are oppressed, and it gives you the opportunity to build cross organizations, create collaborations, cross movements. Because at the end of the day, if people aren't able to control their own bodies, and when not they're going to reproduce or have the ability to parent the children they already have with dignity and safe and sustainable communities, then everything that we're doing, what are we doing it for? It's a wrap, so this framework is just so, it's so powerful. And it's a way for people to start having conversations that go beyond whether or not someone's going to have an abortion or not.
I love the way you frame justice as what's in the viewfinder far ahead and what we're trying to reach, and as the tool we use to get there. Like, I love that, the duality of how you frame that. I think that is something that is easy to forget, that, we're seeking justice, and in doing so, we have to enact justice. We have to, embody justice. You were saying in your answer, justice is the pulpit from which you can talk about what the vision of reproductive freedom can look like. And I think your spirituality is really the through line of this book, your relationship to your spirituality and how it impacts your life and your work. And I particularly like the way that you broke your life's work into the frameworks of service delivery, legal advocacy, and organizing. And I wonder, living and practicing in Arizona, a state where abortion rights have never been guaranteed, especially for Black folks and Indigenous folks and other people of color. How does your spirituality influence, or what is your relationship between your spirituality and these three main frameworks of your life's work? And I think I'm particularly interested because in your book, you said my practice is my ministry. And I loved that. I found that so meaningful. And the work that you do training students, to me, also feels like part of that ministry, part of spreading the word. And so I'd love to hear, how does your faith influence the way you practice medicine, the way that you practice advocacy, and the way that you practice organizing?
Well, interestingly, I never thought about my faith in the way that you're asking that question. So that's really cool to think of it that way. So for me, first of all, it was never my intention to have a practice of my own, a private practice. As I was going through my training and starting to think about what my career looked like, I envisioned myself being an academic physician, clinical researcher, a full professor, somebody's OBGYN department chair somewhere in the country. And what happened was, as I was becoming an abortion provider, the strong sense of justice that I've always felt since I was young was just really pulling at me, that there were so many people who were willing to help people continue pregnancies and birth, and there were not enough people who would help people who did not want to continue pregnancies and wanted abortion. And so it was this really strong sense of justice initially that had me pursue learning how to do later abortions and concentrate my career, do a family planning fellowship, and really concentrate my advocacy in that way. And what I try to convey to the students I train and the residents I train is that once you become an abortion provider, then you become an advocate for the care, for the people who need it, and for the people who provide it. It's just not as polarizing as things are, and as few of us as there are in the grand scheme of things. It's just, we just can't sit on the sidelines and just go into a clinic and do abortions. And I think the students get that. There had been this chorus in the back of my mind that folks were like, you need to start your own practice. I'm like, I don't want to do that. I don't want the headache. I don't recommend it still. But I started to have this really deep feeling about how I wanted people to feel, how I wanted people to be treated when they went into a space to have an abortion. And it became very clear to me that I would not be able to create that working for somebody else. And so there had been some constellations of things that happened that led me to a place where I was contemplating my future. And then, again, it just got louder. Start your own practice, start your own practice. Multiple people, start your own practice, start your own practice. And so I felt like when I finally said yes, everything aligned. It was like I was answering a calling. Because let me tell you how this happened. I made the decision in April 2013 that I would start my practice. I incorporated Desert Star Family Planning in Phoenix, Arizona in May of 2013. I was working to get a loan. I was negotiating the lease. I was trying to find a place for a building. I was buying stuff. I was hiring people. I didn't even have the loan or the building yet. And then right when I was redlining the lease, I was like literally redlining the lease, then the loan came through. And then we moved into the building in August and opened the doors the day after Labor Day, September 3rd, 2013. That's how quickly it happened. It had to be divinely inspired. And so, I talk about in the book how I was born in a spiritual family, Christian based, but I was never we didn't really get into the dogma of religion. And we definitely never talked about abortion. I mean, my interaction with abortion was really friends who were pregnant, had abortions. And my other interaction with the religious aspect related to abortion were these hateful people who were using God and the Bible to harass me. And so I had a moment early on where I was like, of course I still believe in God, but I'm going to have to like put this down for a minute, because I got to reconcile all this hate that I'm receiving in Jesus' name, and so what started happening was I was seeing patients really struggling with the religiosity, with that aspect of stigma and, persecution. And so at that point, then I opened myself back up to allow my own spirituality to grow and also infuse it into the practice. And so I've prayed with patients in the clinic. Patients have prayed for me in the clinic. I've had people break down in tears because when they realized that their doctor prays for them, and they were just really concerned about, reconciling their faith with a potential faithless provider. And granted, there are a lot of people of different faiths. There are a lot of people with no faith. And at the end of the day, people are being well taken care of from a physical sense. But there is an unmet need of people of faith in terms of addressing their spiritual concerns for when they're having an abortion. And so what helped me realize that the clinic was my ministry was actually my own finding a church here in Arizona and growing spiritually. And I remember the pastor said, we all have a ministry. And that's when it like dawned on me, like, this is my ministry, and I've leaned into it ever since.
The story of you starting your clinic and of what that took, and of, redlining the lease and waiting for the loan to come in, that is such a crystallization, not only of what it feels like to be divinely inspired to do something, but also the way that you are so community forward. You are led by the spirit of community, and in your work and in your life. And that is such a great example of that. You knew that starting a clinic was going to serve your community, and you were like, the rest will come. I'm gonna go. And I can speak with some experience here that is how you do your work always. And it's a really special thing to watch. I know we have questions coming in, and I have about a million questions more, but I think one that I think is in part of one of the questions for the Q&A, and one that we talked about a little bit earlier, is that in your book in chapter 7, you talk a lot about how disinformation is rampant on the anti-abortion side. And we all know that rage is a really powerful motivator, and the narrative of the anti-abortion side is lies upon lies about how God would want it a certain way, lies about what abortion actually is and what it means to have an abortion, and what it is to be a person who has had an abortion. I am Hindu. We don't believe in heaven and hell. We do believe in reincarnation. And to be told walking into my abortion appointment that I'm going to hell, I was like, I don't even have the time to tell you how wrong you are in the words that I would like to tell you. And so I wanted to ask you, what do you think about how we take back the narrative? How do we take back the narrative on ensuring reproductive freedom and reproductive justice for everybody? The fact of the matter is, they've won, right? They accomplished their goal. And now we are here, and we are stuck in the quagmire of the story that they've written for us. How do we get out?
A big part of this is we have to, there are so many things going through my head right now. So the first thing is we really need faith leaders to step up and speak to the realities of religion and abortion. In my book, I give some examples of some statements that have been made by leaders of different types of Christian-based religions that really are affirming for people who are struggling with this narrative. One of the things that I said several years ago was like, I am not ceding the moral high ground to these extremists. What we are doing is moral and ethical for people. We are saving lives, and we are literally saving lives, but we're also saving lives in the way that we are saving the lives that people have envisioned and dreamed for themselves that they don't have to throw away because they become unintentionally pregnant. But religious leaders really have a moment to meet right now because their people are suffering. The other piece of this is normalizing conversations with each other. Abortion is not only abortion is stigmatized, it's all pregnancy outcomes and experiences that are not the raised up white supremacist, heteronormative, Christian-based idea of how people are supposed to behave when they're pregnant and how they're supposed to feel about parenting. And so as we're breaking through all of that and people are having real conversations with each other, you know, like this younger, I was having a conversation with someone recently where this younger generation of people are like, F them kids, you know, like older women are like, oh my God, you really saying that? Like, I'm not trying to have kids, like, get out of here, you know? And so hopefully, you know, that makes me hopeful that we can at some point get beyond this whole idea that I have to be a perfectly happy pregnant person. I need to give birth and, you know, feel like I'm dying without pain medicine. And then I have to be super joyful and happy postpartum. And then I have to, like, you know, be this absolutely wonderful, fantastic, calm, with it, organized parent, right? And until people start having honest discussions about that's not their reality, you know, then the narrative doesn't shift. The other thing is miscarriage too, pregnancy loss. It's such taboo. People don't talk about that either. And so all of these ways that people feel like they're failing in pregnancy are all because we are not talking to each other. We're not, you know, letting people see themselves in the next person, and they're feeling isolated and alone, like they're going through this by themselves.
Thank you for that. I totally agree. I had my abortion in Indiana and when I was 19, and so many people want to tell my story for me. And it's wild how many things they want to fill in. I must have been so upset and I must have been so conflicted and like, nah, my roommates made me a cake and we had a party when I got home. Like it wasn't what the story they want me to tell is. I know we have questions coming in the chat and there's a question in the Q&A. Michelle, did you wanna moderate some of the Q&A for us?
Sure. The Q&A here, and I think you touched a little bit on that just now. It says, the framing used in Ireland for their Together for Yes campaign a few years back very deliberately left out the word abortion in favor of emphasizing the importance of personal control and power over their own health and destiny. I generally don't agree with that because it reinforces stigma. But I'm also a fan of what works. Do you feel like modifying the message to avoid people shutting down, especially in heavily religious audiences where the idea of being pro-abortion is seen as satanic, is a smart strategy or ultimately counterproductive? So basically, like, should we shift the messaging to not say certain things that may trigger, you know, some folks in the community, especially religious communities? So I guess this can go for either one of you that wanna answer.
I'll go first. So I am a big fan of moving people to actually be unapologetically pro-abortion and say the word abortion. Abortion is not a dirty word. Abortion is a medical term. We have induced abortions and we have spontaneous ones. we call them miscarriages in lay terms. So I think to the extent that we can move people along to be comfortable talking about abortion and saying the word, we want to do that. Now, having said that, we also want to win. And so I think it's really important to know your audience and to be able to speak to people and help move them along. And so a good example of that is our governor, Katie Hobbs, quoted some stats where 90% of Arizonans believe that people should have the ability to form the families they want when they want. And so 90% of Arizonans agree with that. But then when you take polling that specifically says the word abortion, then people start to get their feelings all involved and then start to feel fine with state mandated reproductive oppression and violence and harassments against providers and abortion seekers. And so my big thing is know your audience, but also try not to give too much ground, because we definitely don't want to reinforce stigma, as you mentioned, Emily. Arpita?
Yeah, I would generally agree. And I think what SD has put into the chat is really important as well. Being unapologetically anti-abortion shouldn't be like a radical position. It is pro, family, it is pro community, it is pro dignity, it is pro autonomy. But we kind of let the other side tell us that abortion was a bad word. And I think Ireland's context is Ireland's context, right? And they won, and that's important. But I agree with knowing your audience. I agree with modulating your messaging based on if you're talking to a legislator or a community member. I think we have to draw lines in the sand, though, on what we're willing to compromise on. And I think the word abortion shouldn't be one of the things we compromise on. Because then we're just letting the other side tell us that we're not allowed to say that word.
Thank you both. What great question. Thank you. Another question here. Oh, and I'll just read off what someone in the chat said, which I think is great also to add. The stereotypes of our culture has about abortion are like a grand anti-fairy tale. We need to keep building toward a world where people listen to the experiences of those who have actually gone through it, rather than relying on making judgments from harmful generalizations. Thank you for sharing that, SD. Another question here for Dr. Taylor, kind of in that same view of what you were talking about, listening. What is one thing that the community or we as supporters and advocates, what is one thing that we can do to understand, learn, and support the work of independent abortion providers like yourself?
So I want to lift up an organization that Desert Star Family Planning Clinic is a member of, which is the Abortion Care Network. And they put out something called Communities Need Clinic. And so the most recent one for 2022 came out in December. And it's a good resource to really understand the role that independent abortion clinics like Desert Star Family Planning play in the ecosystem of providing abortion care. So 3 in 5 people who have abortions in the United States have their abortion at an independent abortion clinic. And then that number, the percentage of people who have abortions at an independent clinic increases as gestation increases. So once you get into the second trimester, then a larger majority of independent clinics are providing those. And then once you get into third trimester abortions, then only independent abortion clinics are doing those. And so, and that was the case with Desert Star Family Planning. The majority of the care that we were providing prior to our 15-week ban was second trimester and later abortion care. And so And also independent abortion clinics are the main ones who are involved in the major cases that are going on, challenging anti-abortion laws across the country, and definitely the cases that have made it up to the Supreme Court. And so, and we're closing at alarming rates. And even my clinic, Desert Star Family Planning, is in jeopardy, considering that most of our abortions that we did were beyond 15 weeks, then having a 15-week ban would mean that we'd have to see 2 to 3 times as many patients as we saw prior to the ban to maintain the same level of operations, which isn't possible. And so we don't have the resources and the backing and the marketing machine that other organizations have to be able to flow funds. And most of the clinics are taxable entities. I don't like to say for profit, because there's not profit in providing people abortion care when you're leading with your values, like most independent abortion providers are. So understand that likely, definitely learn who your independent abortion provider is in your state and really reach out to them to figure out how you can support.
Thank you. Absolutely. I put the link there, and so hopefully there will be some more building around how to support independent abortion providers, and also just getting more providers to the places where have already been underserved, right? There's a lot of places, especially in Arizona, like northern Arizona and rural areas, that have very limited access to any care for many years. But with that, there's a few minutes left, and so we'd love to hear some closing thoughts from both of you, maybe a little like riling calls to actions that you could share with us as we're commemorating this, this important day in our history in American society. What can you let us know that we can do to continue forward and see the next 6 months after, the fall of Roe?
Well, first, thank you, DeShawn. Thank you, Michelle, for inviting me to this event and for letting me read this book and ask you questions about it. It really is such a joy. And I will be quick and say, we need everybody. We need everybody to get up and be comfortable getting uncomfortable with the conversations that need to be had, and to leave Roe behind. I know it's hard. We lost it, and that is a loss, and it deserves our grief and our compassion. And we need to leave it behind, and we need to let it go. We can have something bigger. We can have something better. DeShawn's book lays out really beautifully what it would mean to have something better. And I think that it is meaningful to want more than what we've had in the past. And I will say, donate to your local independent clinic. Look them up on Abortion Care Network, look them up on Keep Our Clinics, find your local independent provider, and, donate money, donate time, donate whatever it is they need. We need independent providers to keep the abortion environment at all stable. Donate to abortion funds, find your local fund, keep donating, and donate your time, donate your energy. There can't just be a few of us in this fight. We are going to get tired. So I will hand it off to DeShawn to close us out.
So for the first call to action I have when Arpita says donate to clinics, we have a GoFundMe. So this is the link. Keep our clinic open. And those of you who would like to give money directly to the clinic without third parties getting involved in that, you can Zelle or PayPal to info@desertstarfp.com. And then we're also on Venmo. So that money comes directly to the clinic. It's Desert Star 2013. So yeah, definitely send money if you have it. Otherwise, I think that we're at a moment in time where saying, I don't do politics, it's time to let that go, because our lives are political. Our lives are at stake. If we're not actively engaged in making our own lives better, then guess what's going to happen? Oppressive forces are going to continue to oppress us. And so we cannot continue to expect that, oh, that person's going to do it. Oh, that person's going to do it. You know, I'm fine. I can get what I need when I need it. But guess what? A whole lot of people can't get what they need when they need it now. There are 14 states who don't have an abortion provider. And that's likely to grow. So, you know, it is imperative that we, you know, at a minimum, understand what the landscape is around people's access to care. And from a justice lens, it's all of it related to bodily autonomy, our right to have children, our right to not have children, our right to parent children in safe and sustainable communities. All of those things, that's what reproductive justice is. And so if you care about maternal mortality, if you care about people having affordable housing and children being able to get baby formula and access to nutritious food, as well as care about abortion, then hey, reproductive justice is for you. And you know, there's an opportunity for you to find your lane and get involved. So I see the time, it's 7:02, and I want to honor that.
Thank you both. Thank you, Dr. DeShawn Taylor. It's an honor to work with you and be here in this amazing, special time in the world. And Arpita and NIRH, thank you so much for all the support and wisdom that you share. It is truly invaluable. I don't know how we would do what we do without you. So thank you both. And thank you to all who joined us. I hope you learned, you got inspired. And we look forward to continue having these conversations. So stay tuned for Dr. Taylor's book that is phenomenal, and keep bringing folks in here so we can also share this work and get liberated together. So have a wonderful night, and thank you all for this time. Yay.